Hey guys, I just wanted to get on here and show you this ultrasound that I did yesterday of my patient. She was actually having temporal injections done, and so very interesting. So right here I'm showing the one up one over maneuver right here on the temples. So I ultrasound this area every time before I do any injections, and the funny thing is we were taught to go right on bone here. So you go one up one over, gunshot method, right onto the bone. Well, in this ultrasound, you can see the skin's up here, just to orient you. Skin, superficial fat pad, then we have our superficial temporal fascia. It kind of acts like our SMAS, where our artery normally is in, and it's a little bit above that, what they say in textbooks. And then underneath that, we have our deep temporal fascia. Then we have a little intermediate fat pad. I know my finger's kind of not showing it. And then we have the deep part of the temporal fascia. Then if the patient were to clench in the video, you would see the temporalis muscle contract, and then below that is deep fat, and then the periosteum. So bone, temporalis muscle, deep temporal fascia, empty space, superficial temporal fascia, and skin. Just to make it a little bit less confusing, the main thing is that the artery is directly on bone here. We do not want to see this, because if I were to inject right on with the needle, I would get right into the anterior temporal artery. That can cause blindness, can cause stroke, can cause a lot of things. And the scary thing is, if you do something like, let's say, radius, a calcium hydroxyapatite, which some clients actually have done in their temples, that is non-reversible. There's nothing you can do there. So really scary. Make sure your injector uses an ultrasound whenever they do your temples, because you do not want anything to happen. For this client here, what we did, okay, so I got cut off there, but we obviously did not go on bone here. For this client, what we actually did is we went with cannula, and we pierced through the superficial temporal fascia and stayed right below it and added sculpture to help with volume loss and really give her the temple she wanted, to build some collagen and just to fill her out more. Okay, so that's why we use ultrasound. Let me know if you guys have any questions by DMing me or commenting.